Welcome to our third and last webinar in the NAVIDENT 2 TAP trilogy. Today's webinar will deal with trace registration or trace and place in the mandible. On our first webinar, we have introduced NAVIDENT's new trace registration method, which utilizes natural structures already present in the conventional diagnostic CBCT scan, such as teeth, crowns, and abutments, and uses them as a natural fiducial for the registration, instead of the traditionally used artificial fiducial. On the second webinar, we went through the different steps of the trace registration workflow for a maxillary case, starting with the importation of the diagnostic CBCT scan into NAVIDENT, followed by the selection and marking of the structures for tracing, over to the installation of the head tracker used for tracking of the patient's maxilla, and the tracing itself on the patient's maxillary teeth. The navigated osteotomy step remains unchanged. On today's webinar, I'll review the workflow for the mandible, which oddly enough resembles the maxillary one, and therefore I'll focus mainly on step 3, because instead of the head tracker used for the maxilla, for the mandible we use another tag called jaw tracker. So let's go through the sequence. The CBCT scan is imported. This time I select the mandible. Note that even if only one jaw is present in the scan, I still have to place the red line at the level of the occlusal plane. I then indicate it is the mandible I'm going to be working on. Drawing of the jaw centerline curve, going through the scan, making sure no motion artifacts are present, marking of the inferior alveolar nerve canal, and planning of crowns and the implants. As always, the plan is being continuously and automatically saved. Next, I select the landmarks for tracing. In this case, these are teeth crowns, but artificial crowns and abutments can also be used for that purpose. Now that the planning part is complete, I can proceed to the installation of the jaw tracker. The jaw tracker assembly is a single-use part, which consists of a marker plastic tag connected to a bendable stainless steel wire. The jaw tracker is installed on the patient's jaw by affixing its connecting bendable wire with a dual-cure composite resin to a tooth, crown, or abutment. Since no etching or bonding agent is being used, the removal at the end of the procedure is quick and simple. First, the wire needs to be bent into the right shape to position the tracker so it will face the camera and will minimally interfere with the motions of the surgeon and the assistant. We also want to minimize potential camera's line of sight interruptions. Using the bird beak pliers, the last 5 to 6 millimeters of the wire are bent for the attachment to the tooth on its lingual side. By default, the tracker should be placed at the front, with a clearance of at least 1 inch above the patient's chest to avoid bumping into it. I can now connect the wire to the tooth or teeth. I start with applying a thin continuous layer of material onto the lingual and incisal surfaces of the selected anchoring incisor. It can be convenient to use 2 teeth crowns and to place the wire just over the embrasure area. I now place the bent 6 mm part of the wire in the composite material, so it comes in contact with the lingual side of the teeth, while aligned in parallel with the tooth length axis, with the rest of the wire crossing over the incisal edge, or the embrasure in this case. I light cure for about 20 seconds, while holding the wire steady in its place. I add an extra layer of composite resin onto the lingual to completely cover the part of the wire that's in contact with the tooth, and I light cure it again. Lastly, I also add some material onto the buccal aspect of the tooth to create a larger, sturdy bulk. The whole process of adjusting and connecting of the jaw tracker to the jaw takes about 5 minutes overall. After the jaw tracker has been installed, I can move over to tracing. This time I will not go over the minor details since these have been reviewed on our previous webinar dealing with the maxilla. Tracing step starts with the calibration of the tracer tooltip, followed by the tracing on the teeth I have marked. Holding the tracer still on the buccal aspect of the first tooth I selected, as close as possible to the location of my first landmark. and I trace by sliding the ball tip over the surface of the tooth, on at least 3 sides of it, buccal, occlusal, and lingual. As I trace, the points are being collected. "100 points have been recorded for this tooth, so I move over to the next landmark. I have to start tracing on the landmark, but I don't need to stay on the same tooth. I can continue the tracing on the adjacent ones as long as I keep my tracer on the surface. Accurate registration requires a minimum of 3 landmarks, but here I've marked 4, so I need to trace them all. I keep the ball tip on the surface all the time, making sure to perform frequent crossings over the incisal edges, tracing them too. We can see that an average single tracing takes about 17 seconds, so the whole tracing required for the registration of the patient's jaw with its scan would take about 1 minute. I now verify the registration's accuracy by touching with the tracer's tip on different locations on the teeth and comparing its physical location on the tooth with its virtual representation on the screen. Once accuracy has been verified, we can proceed to the surgical navigation part.